Okay, guys, welcome. As I said, please make sure you've got your chat box open. That enables me to answer any questions as we go along. And please don't hesitate. There's no question is a silly question. And for your privacy, what we've done is we're actually not going to live stream this, just in case there's any sort of thing that you may at a later date want to take out. And the chat box is actually only seen by myself. So you can be assured that that's not part of any video that we put up out to a public audience. So after we've completed this, we will be posting it on our Facebook page and also on our blog section of our website. Just as if you miss anything and you've got to shoot in and out, you can actually just log on at any time to have a look at the bits that we've missed. So yeah, let's get that chat up and then we can talk as we go. I adore this. So questions are coming through already. Yay. Okay, vibration toothbrush. There is some evidence that it actually can be of assistance. You've just got to be really careful. Sorry, let me preface what the vibration toothbrush is for, given that we're working in pelvic health. So for blocked ducts or for lactating breast, is there some stuff in terms of a vibration toothbrush? Absolutely, but super gently. You'll be amazed how gentle you have to be on the breast tissue. Okay, so let's get started, everyone. Thank you so much for joining us. My name is Alex Lopes, and I'm the Director of Pelvic Health Melbourne, and we're in Yarraville, Taylors Lakes, Bundoora, and Port Melbourne. This session, as I said, is all about you, and it's about normal pelvic health. I highly encourage any questions as we go along. So let's get started. Hopefully you can all see my screen clearly. If you're having any difficulties, please post a question. Okay. So let's get started. There we go. All right, so what are we covering today? We are going to cover in this order: bladder, bowel, intimacy, and pelvic floor. The first stuff hopefully is going to be really interesting for you because I'm sure you can think of times when there's been issues for yourself in all those fields. So we'll talk about and hopefully give you some interesting facts about each part. Now remember, this session is all about normal. So let's start with the bladder. So what is normal bladder function? Let's have a look. So do you go about 4 to 7 times a day? That's assuming that actually you only drink 1.5 to 2 litres. A lot of my clients drink 3 to 4 litres, and so therefore you've got to be going much more frequently. It's all dependent on the amount you drink. I'm not advocating 3 to 4 litres. That is often overfilling and overloading your system. So 1.5 to 2 litres is plenty, and we say a maximum, ideally, of 1/2 litre more for breastfeeding, but there's actually no evidence to support that. The actual statement on breastfeeding and how much water you should have is adequate to sustain the breastfeeding mother's thirst. So it's really quite vague. Based on a full study of all the literature, they don't feel you need to have more in every case. So just base it on your thirst. So 4 to 7 times a day in terms of going to the toilet. Nighttime function, and this is an interesting one. How many times should you wake up overnight? We're saying under 60, 0 to 1. Now, of course, if you've got a baby, that's a different story. And you're drinking a lot overnight, that's a different story. But general rule, 0 to 1 under 60 and 1 to 2 over 60 is within normal for bladder function. So after that, I'm just having some issues moving on. Okay, normal bladder capacity. This is an interesting one. How much should I wee out? You can actually measure this. If you get a measuring cup from your kitchen, you measure your average void, even a big one, just to find out what actually is your capacity. 300 to 400 mils is about an average capacity for an adult female bladder. The 300's the female, the 400's the male, and it is dependent on your overall size. The maximum capacity is 600 to 800 mils. Why is this relevant? If you find you're going every hour and small amounts, something's going on with your bladder. Yeah? So that's kind of just the normal figures. When we talk about flow, the reason I talk about flow is because so many things can happen to your flow. So what should happen is you sit on the toilet, it starts off a bit slow, gets faster, and then trickles away. So if you come to the toilet and you've got explosive flow, it stops or starts. You have some hesitancy. You've got a split stream, or you get some after dribble. they're all the indications that a couple of things are going on. And where should you feel the urge? The fullness should be felt in the lower belly, not actually down there. Yeah, so that's for both guys and females, so males and females. Sorry, for those with a penis and those with a vagina. Okay, let's move on. So what is normal bowel function? So that just covers bladder function. Normal bowel function. So normal bowel function 3 times a day to 3 times a week. Some of the more recent research is actually questioning that when they've done big international studies, and they found the average across huge cohorts when they looked at it is around 1.1. Yeah, so what that means is on average, you do go once a day. Now, we look at Pelvic Health Melbourne, we always ask about your diameter. I know they're wacky questions. How thick is it? And I have so many patients who say to me, I don't look, Alex. And I say, please look in the bowl. Yeah, it tells us a lot of stuff. So how thick is it? If you're really skinny, so skinny guys, about that, normal, about that, large, that. They tell us different things. Your anus is like a sausage press. If it's too tight, they'll be skinny and short. If it's a bit loose, they'll be larger. Or if you've got a little bit of rectal prolapse, they'll be larger. So the ideal, we hope your poos is like that, the ideal length is actually 8 to 13 centimetres. So if you've got little chipolatas, you might be puckering up and cutting them off a bit early. So next time you do a poo, have a look at how you're doing it. Have a look at what it looks like in the bowl, sorry. Okay. So how often? Now, what should it look like? It's consistency. This is another question we ask. Ideally, it should come out like a Teflon coated sausage. I don't know where I've heard that, but basically the idea is kind of like an egg. It pops out with very little smearing. Yeah, so we say kind of 3 wipes is good to kind of have cleared it. If you have excessive pasty poos, that means 7 to 10 wipes to clean it up. It's often indicative of a high vegetable diet. So that's fantastic. You're eating well, but sometimes you don't quite want it that pasty, and so you can add a little bit of fibre to your diet. Easy things to add is keeping the skin on your vegetables. That adds a bit of fibre. If you want a little bit of assistance, Benefiber, Norma Fibre are not bad, but do speak to your pharmacist to get the right thing for you. The other thing with pasty poo leaves a bit of skitties and sometimes not so nice to clean up. So let's try and get that poo looking beautiful. Does it float or sink? Does it matter? No. Okay, so whether it floats or sinks is all about the density of what you've eaten. It doesn't mean you're dehydrated. So there's lots of myths out there. It really doesn't matter. And yes, they've done heaps of research on how long people sit on the toilet. Average is 12 seconds up to 10 minutes, and I reckon that's the males who skew the percentage as they sit on the toilet. Although, having said that, I don't know about you, but some of the young teenagers sit on the toilet a lot with their phones. So that's the average time to empty. So let's talk about sitting position to assist your emptying of your poos. If you look at this first image on the left, so let me just get my pointer out for you. So if we've got this first image sitting here, this is the normal resting angle if you're just sitting upright on the toilet. So what that means is the poo's got to actually push past this hook-like muscle of your pelvic floor, which is one of the first bands of your pelvic floor. The ideal position, so you can see this image of this person, he or she is sitting upright. Yeah. Then the mimicking this position of the squatting position, or with the chest to the knees or knees to the chest, helps straighten the poo chute. Thus, why third world countries, and they do statistically have significantly less bowel problems than first world countries. Now, I know that's diet, but a lot can be said for that position. So am I advocating you all stand on your toilets? Absolutely not. You'll see in this image on the right, this is overkill. Yeah, this is advertising with the potty squatty potty. It's too much. Most people, when they sit, most adults, when they try and put their feet on these things, they haven't got the range around their back and their hip to adequately get in this position. If you do, great, get a stool. But for most adults, feet on the ground and bending forwards with your knees on your elbows way forwards is enough of a position to straighten your poo chute. Yes, that's what you say. Straighten poo chute And then to open poo chute, you've got to below the stomach, not suck in. I don't think I've actually got a discussion about that. That's a really big factor. 40% of people suck in. I think it was this Australian study, 40% actually suck their bellies in and their pelvic floors on when they strain on the toilet. You need to below the stomach out, push the stomach out, and that opens your poo chute to assist with a normal diameter poo. I bet you never wanted to know that much about poo. I'm going to segue here a little bit because we've got another question. Okay, I might come back to that one because it's got a couple of parts to it later or perhaps at the end. Okay, so that's a bit about bowel. Now I told you you've got to look in the toilet. So what I want you to do next time you look in the toilet is see what they look like. Each of these numbers tells us a different thing. So if you're 1 or 2, you're constipated. So if you've got little pebbles or really hard pebbly logs, you know you're constipated. The easiest thing to do generally is your first line of defence is increase your fluids. Then it's looking at a bit about the diet and or getting some assistance, so speak to the pharmacist. So 1 and 2's ideally not what we want. We want closer to 3 and 4. If you have 5, 6 and 7, that tends to mean you've got more food sensitivities. Yeah, food irritations, things like that. And so you've got to watch what exactly it is that's causing problems for you in terms of the food intake. So that's the poos, what they should look like, and what's a good poo. So you're great discussion tonight at the dinner table to talk to the family about what theirs looks like. If it's anything like my family, it's oh, Mum, they get sick of all that. Normal wind, yes, we talk about farting too. What does it mean? Did you know that 14 to 23 times a day is normal? When I say that, most people go, oh, no. So can you hold it? Can you let it go? It isn't ideal to let it go. You should actually allow them to come out, however, in an appropriate time. If you can hold it, that's great. If you can't let them go, so I have a lot of clients who come to me and say, I don't fart, I don't pass wind, and I actually find it really difficult to let go. That tends to mean the canal or your sphincter is pretty tight. So that's an indication of an overactive pelvic floor. If you can't hold it, could be a couple of things. It could be a really bad food reaction, and after you eat the food, it's propelled out so fast and hard that you can't hold it, or it means the pelvic floor or the anal sphincter is weak. So farting and being able to hold it or not gives us a bit of indication of what's going on at home and or with your body. Normal sexual function. Probably the biggest myths are around sexual awareness, or probably, I think, in Australia at least, it's one of the things that we see the most commonly is poor body awareness for both males and females about their anatomy and where the orgasm occurs. So let's go in basic detail about normal sexual function. So if we have a look at this image, this may be a surprise to some of you. Let's just keep our eye on the left of the screen. This is the structure of the actual clitoris. This is where it's embedded in the external muscle of the pelvic floor, or the most superficial. So this is the clitoral hood, this is the actual clitoris that we often know about, it being the nub. It's actually got a wishbone structure, which is more rigid, that sits along the sides of this pubic bone here. And this area here, which I'll show you later on, is actually erectile tissue, very similar to the male penis erectile tissue, which engorges with blood. So the actual organ itself is not just the hood. So really important, one, for you to know about so that you can assist your partner with pleasing you. 2, to be telling your children and educating your children about what their body parts are like. And we'll go on in terms of, stimulation a bit when we talk about normal function. For the males, their sexual function occurs both in the pelvic floor, which sits around here. So you see how it wraps around the penis. And then I'll go and talk on with dysfunction with males. And they've also got erectile tissue here. So the main thing with males is it stops seepage. So in terms of erection strength, as men get older, they often are unable to get as strong an erection because this pelvic floor weakens as well as their blood flow, and they get a bit of seepage. So it's really important to talk to your men folk to say pelvic floor health is also synonymous with good sexual health. So it's really important for both males and females to keep that pelvic floor as good as we can. Please, I'm happy to take questions as we go through at any point in time. So don't hesitate to ask any questions as we go through, and then I'll answer any ones that might be a bit more specific at the end. Okay, so this is a fantastic, we'll go through the image later, but let's talk about the myths. So I have women saying to me, there's something wrong with me. I can't orgasm with penetration. So statistically, only 25% of women can orgasm with penetration. Most women need clitoral stimulation, and the body of the clitoris, or most of it, is outside. So having said that, let's bring our focus over to the image on the right. I'll give credits to this image on the next page. Here is the clitoral hood. Here is the clitoral wings. This is the area of engorgement. Now, in this image, the actual urethra, or part of the bladder, is done as really thick. Actually, the back of the clitoris sits here, very close. The diameter of this urethra is about 2 to 3 mils, so it's disproportionately drawn in this picture. When this engorges, it pressurizes here. So that idea of the G-spot being 4 centimetres in on the front surface of the vagina, we believe it's possible that that's actually just the back of the clitoris. And that's why stimulation of that spot for some women can be beneficial. So pain with sexual intercourse on entry or with deep penetration is not normal. So please go and see someone. And if you're seeing a physio, it's actually a pelvic health physio that you need to see. A women's health physio, there's a slight difference. A women's health physio will tend to see a peripartum woman and a menopausal woman in terms of exercise and pregnancy, but they don't do the intimate stuff, the insides. So we talked about the G-spot and where it is and why it's correlated. Lube, okay, so lubrication. When we're peripartum, pregnant's not so bad for some women, definitely postnatal, we don't lubricate the same. Same with perimenopause. So any of you who are over 42, menopause starts at 42. I say to all my women, we moisturise here, why aren't we looking up to down there? That's where our lubrication starts to decline. So any of you with a lubrication issue, you need silicone-based lubes, not water-based. Water absorbs too fast into the tissue. Be careful of oil-based. They affect the condoms. There's a potential weakness in the condom structure from oil-based, but silicone-based are quite safe to use. So definitely highly recommend lubes for any of you who are having any difficulty or issues of friction or discomfort. Normal male function. So some of the myths, males get erections 4 to 6 times a night. That keeps their erectile tissue functioning. It's kind of like, I always think it like a sea sponge, and the water or the waves are constantly keeping that sea sponge alive. Interesting one. Did you know all men develop prostate cancer if they live long enough? So the prostate starts to enlarge from 40. So first signs of prostate enlargement for men is bladder urgency and/or stop-start flow. It means that the prostate's compressing close to the bladder. So keep an eye on your men folk and definitely have a listen to their P's and see if there's any issues going on there. This is one of the most, I think, under published data in terms of men, and for us women to understand. 40% of men develop erectile dysfunction at 40, 50% at 50, 60% at 60. The most important thing for hard health, as in erectile health, is heart health. Keeping our men fit optimises their their erectile function, as well as, and we've got great research now coming out, that pelvic floor health also affects that. So let me come back and make sure there's no other questions come through. I'll just get, I've got a co-host here and she can assist me if questions have come through that I haven't seen. Okay, perfect. All right, so let's move on now to pelvic floor muscles. So before I move on, I just want to ask you any questions that you might have in terms of your bladder, bowel or intimate health. Remember, these questions are anonymous. You can actually link it private as well. The chat's not going up on the video at all. And we will, double check the privacy. So don't forget to ask some questions as we go. So let's talk about your pelvic floor muscles. So pelvic floor muscles, the 3 key things we're going to cover in this section is what do they do? How do I turn them on? How do I know if I'm activating them properly? And what is normal pelvic floor strength? So let's go. What do pelvic floor muscles do? The key first thing is they support the organs in the pelvis. So for the female, we have the bowel, the uterus, the bladder. For the male, it's the bowel and the bladder. So one key role. Number two, they control bladder, bowel and wind release, as well as obviously holding. And they're involved in normal sexual functions. So there's three key functions of the pelvic floor. So let's talk about the support, how they support it, just so you get a really good picture of what they actually do. They sit underneath the organs. So they're fairly critical to actually keeping the organs in place. They're one part. The connective tissue obviously attaching the organs to the wall is another very big part. This is a really great diagram, probably the best I've ever been able to find from primal pictures. It shows the pelvic floor in a good light and in probably the most anatomically correct light. So here's our pelvic floor sweeping around. It's a little bit broader here. Here's the anal, the anus, if you like, in terms of muscular through here. And here's that muscle. It's actually drawn a little bit different. There's a muscle that wraps around here, which is the one that kinks the bowel. So you can see that bowel angle that we talked about before. It kinks the bowel into that position that helps maintain continence. And in this image, you can actually see the clitoris here. So here's the clitoral nud, the top of the clitoris. Here's the wings or the fishbone structure. And here is your erectile tissue shown in grey. Here is the vagina or the labia from the outside. And obviously that's looking underneath. Okay, so that's what a pelvic floor does. We've talked about how it supports the bladder, uterus and bowel. Let's now talk about how does it control bladder, bowel and wind release. So again, put as simply as we can. Here's the bladder, that's the structure. You've got the ureters coming from the kidney into the bladder. We do have the bladder, the whole wall is a muscle, and then you have external muscular support here. If we look over at this diagram, there is a muscular support here from the pelvic floor that helps keep that neck closed. Helps assist with continence, but it's one of 4 of the continence mechanisms. So I so often have people say, I've done my pelvic floor, I'm still leaking. It's not always about pelvic floor. Okay, there's other things that contribute to bladder leakage. So bowel and wind control, we talked about it and saw this image in the past episode. Here's the one, sorry, just in previous slides. This is the puborectalis, doesn't really matter its name. It's that horseshoe shape that keeps the kink in the bowel. So that's one of the muscles that maintains control, and then it relaxes a little bit with bowel emptying, but your position assists the relaxation. And then the other part, of course, is the anus. Yeah, that's the pucker sausage bit. If you're puckering up too tight around the anus, you'll have skinny poos that get cut off. Hopefully we keep that nice and relaxed, and how we do that is billowing the stomach. Obviously, the anal control is much more about holding wind. So we've covered how the pelvic floor support the bladder, how they control the storage of wee, poo and wind, and now we'll go into a tiny bit more detail about how it works in intimacy. The most important part on this, which I should have had a little bit later, is seeing where the muscles of the pelvic floor envelop for the female. Yeah, so they envelop around the clitoral organs. The biggest thing that we see is overactive pelvic floors, and what that means for a female is that sometimes it's really hard to get over into orgasm. So you might feel pleasure, but you can't achieve an orgasm. Most of the time it's because the pelvic floor is so tight, they're blocking the blood supply to getting into that erectile tissue. For a male, similarly, if the pelvic floor are over tight, it constricts and doesn't allow good blood engorgement, so infilling might be a problem. The other thing that I see is sometimes premature ejaculation, and sometimes that's from poor endurance in terms of pelvic floor, and we can improve it via pelvic floor endurance and different strategies. The other thing we see with both of these is also pain. If the pelvic floor muscles are incredibly tight, they can also produce pain with intimacy. So another part. Now let me jump back to where we were, and we're moving on. We've talked about the key things that the pelvic floor muscles do, which is support the bladder, control the bladder, and normal sexual function. So I'm going to jump forwards now into, let's talk about how do you cue them. So have we had any other questions? No, nothing seen? Okay, so how do I cue them? How do I know what's going on? Remember, guys, I know this is a lot of information. All this we're going to have up on our website, and we'll also have up on our Facebook page that you can come back to. I'm actually not going to go through all these things because there's a lot of them. I'm going to let you read them if you're at leisure to read them. And these are the common cues I've used and colleagues of mine have used over many, many years. So there's 3 parts to both the male and the female pelvic floor. The front part for both helps control bladder, sits close to the clitoris for the female, and for the male is right at the front near the urethra. The middle part is important in sexual functions for both male and female. For the female, it helps lift the organs. For the male, it actually assists to empty out the last little bit of wee because the hose tends to be kinked a bit in terms of the wee tube, and it actually lifts out that after dribble. The back part helps obviously with bowel and wind control. So this will just go through some of the images or cues that might work for you. So hopefully you're able to see these. You can read through these and see, in terms of the front part, is there any cues that work better for you? If you're focusing on the front part of the pelvic floor, which is for a female near the wee tube, same for the male at the base of the penis, can you keep the back and the middle as relaxed as possible and just feel it in the front? Have a try now and see if you can get a sense of any of that front section working from any of those cues. Now bring your focus to the middle part, which is around the vagina for the female. For the male, it is under the testes. We say testes to tummy, nuts to guts. It's that lifting action. So the middle part, see if any of these cues work for you to help you feel a lift. Generally, you'll feel 1.5 to 2 centimetres of lift in the middle, about 0.5 centimetre in the front, and about 2 to 3 centimetres at the back. Don't worry if you can't feel that amount. 1, your sensation might be down. 2, you might be overactive. 3, you might be weak, or you just haven't been focused on feeling it. So that's kind of what we generally look for. And then the back part, we'll go through a couple of images now. Most people we see dominate with their back passage, particularly the men. It's interesting, the men tend to grip around the back a fair bit more. So if you have more prolapsy issues, we really focus you on the middle. If you've got continence issues, we focus you on the front. And obviously bladder, bowel or wind issues, you focus your training on the back. But generally, all 3 parts are really useful to use, particularly as for women, we lose actual anal sphincter tone from 40. So it's really important to incorporate butt squeezes from 40 on. So that's it for the females. I'm just going to move quickly through this. You can access this. I don't believe we've got males on presently. So this might be for any male in your community, in your close community, that it might be relevant for, that you can link them into the particular clues. Sorry, word finding, particular clues for the male. So 3 parts. We both have 3 parts to the pelvic floor with just subtly different functions. So we've covered what do the pelvic floor muscles do. We've covered how do I cue them. And now we're just going to quickly talk about what is normal strength. So pelvic floor muscles, what is normal strength? Okay, so you're all probably been squeezing your muscles. Don't go overkill because you'll actually get sore. But we consider normal pelvic floor strength as if you can hold all 3 parts for 10 seconds and do 10 of them in a row without fatiguing. And you're doing those in standing. Then you wait a minute and you need to do 2 more sets of the same without fatiguing. That's considered normal pelvic floor strength. Having said that, we haven't done a study on 1,000 women to see can they actually do it. In my belief, that's a trained pelvic floor can do that, someone who's used to doing the training. And that's where you might aim to get to if you particularly have some dysfunction. If you don't find you can do pelvic floor daily, as I don't, introduce it if you can, just into your daily lives when you lift. When you lift, when you go to pick something up, baby, shopping, washing, whatever it is, then make sure you try and incorporate that into your life. So that's just our dosage. Again, that's going to be up on our blog, on our website, and also on Facebook in terms of the dosage. Okay, daily, as we said, if you can try and do 2 sets daily is maintenance dosage of that. And either traffic lights are a good cue to try and do it, brushing your teeth, some people do it in the shower. Think of functional things that might remind you to do it. It is ideal to keep our pelvic floor healthy all our lives, because as we go through our lives, as you're already discovering, our body changes significantly. So that's pretty much covered our formal presentation for you. So we covered bladder, bowel, intimacy and pelvic floor muscles in terms of normals. I've had a couple of questions which I'm going to cover at the end in terms of, and please ask away any questions that might be relevant, not necessarily to normal, but anything you're concerned about. So next Friday, we're just going to do a slightly different time. We'll advertise again. I've actually got Jane Howard from Hobsons Bay Maternal Child Health Centres coming with us to just chat. She's going to talk particularly about breast complaints. I'm going to bring up more specifically in terms of constipation and what you can do about it at home if you're suffering with constipation. So that's next week that we're going to be talking about those 2 key things. Thank you for listening. I'm just going to go to some questions now and have a chat on those. So if you've got significant breast complications in terms of engorgement and or the lactating breast, can that contribute to back pain? It can, in terms of if they're significantly engorged and you're in pain, you're gripping so much. Yeah, so that's where it'll contribute because of the tension associated with being in discomfort and pain. So yes, it can cause shoulder girdle problems. Yeah, definitely pain through that thorax or the middle section of the back. And depending on whether you can wear a bra because of the discomfort, absolutely it can contribute to that. So getting that looked at and getting that addressed quickly in terms of the breast complaint hopefully will assist the others. In terms of blood ducts, would you go physio for ultrasound? Yes, I highly recommend seeing an experienced physio for ultrasound. So the physiotherapist, in terms of our training, we would generally do a 3-day full course on breast complaints. So just ensure that the physio you're seeing has done that, because it's not just about the ultrasound. It's about working out what's causing it, assisting you with attachment if there's any issues with that, guiding you to an appropriate lactation consultant if that's required, and making sure we're looking after you, the whole woman, yeah, to making sure you're sleeping okay, you've got enough support. So for us, particularly at Pelvic Health Melbourne, we're passionate about supporting you in whatever way we can, particularly over COVID, because we've been so concerned with the number of lactation problems we've been seeing. I think because there perhaps hasn't been the same amount of home support that there normally has been. So we've definitely seen much more severe problems over this time. So please find your local pelvic health physio. We're happy to see you here in terms of any breast concerns or complaints. Great question. Okay, overactive pelvic floor, which is what we see all the time. So this is just if you've got some time, if you can grab a pen, walk around, get a pen. All right, so what I want you to do with this pen, really, really big on your hand, is put a camera. Okay, so put a really big dot on your hand like this so that it's a reminder. So overactive pelvic floor, one of the most common things that we see. That means you grip. Yeah, so for some people, you grip in the jaw. Jaw and floor work together. So if you're a jaw gripper, your floor is tight. Some people grip in the shoulders as well. So you tend to know, where do I hold tension? Over this time, we're all a bit more tense than normal times. So with that dot, every time you see it for the next 3 days, scan your stomach first and let the tummy go and see if you were gripping. Were you holding tension anywhere in the stomach? Then bring your mind to the pelvic floor. As we've discussed before, it's 3 parts, front, middle, back. Let it go. Drop it. Feel it opening, softening, and see if you feel anything let go. If you do, you were gripping. Keep testing yourself. You can't change what you don't know you're doing. So start being aware of, what do I hold? Why do I hold it? What activities make me grip there? For anyone with leakage, suspected prolapse, pelvic pain, pelvic girdle pain, if you're worried about increased abdominal chub, you'll often grip. Yeah, so the idea, we used to talk about, oh, it's good for me to hold on. We've now found that it's causing so many complications, particularly in terms of intimacy pain and bladder and bowel outlet problems from being too overactive. So people think, I'm overactive, I'm strong. No, you're overactive, you're weak. You're tight and weak. I always say, imagine you're holding 10 bricks in your arm all day, yeah? Or 1 brick, you're gripping it. Imagine when you take that brick away, your arm's going to be tight, the muscles are tight, and it just doesn't relax properly. And it's also fatigued, so therefore it's unable to get optimal function. So down training, the dot Q I find works a treat. So test yourself over the next 3 days and see, do I grip? Where do I grip? What percent do I grip? And let it go. That will assist and start with pelvic floor down training. Yeah. Other stuff, we do is a lot of massage. So we do a lot of abdominal massage to actually release the tension. We do a lot of external pelvic floor and a bit of internal pelvic floor release so that you can feel the difference of what tight versus relaxed is. So I hope that helps with that question. So I'm just going to go back on to see if there's any more questions. Pelvic floor. Oh, thank you. I got a lovely compliment. Thank you. No problem. So yes, absolutely. This presentation, can you see me still, or have I come off? Sorry, when I'm opening that chat. This presentation will absolutely be available both on the Pelvic Health Facebook page, Pelvic Health Melbourne, and also our website. We'll put it under our blog section. As I mentioned, next week we're back on again. Tell your friends, any opportunity to talk. I'll give you my email if you want to ask personal questions. It's alopez, Lopes, @pelvichealth.melbourne. So please don't hesitate to contact me if you're worried about anything, because we're concerned about you. Some of the cases we've been having coming into Pelvic Health Melbourne over this time have been pretty frightening, and I just want you to know that we're here. Okay, so you can call us, you can talk to us, you can come in. So as I said, it's going to be available. So I've got a couple more questions come through. Okay, another good question. Oh, I did miss one. Sorry. Thank you. The other question was in terms of if you've got overactive pelvic floor muscles, should you do them as in terms of up training? Yeah, we tend to do 1 week of down training. So that was a really good question. 1 week of down training until you've got the idea of relaxing. And then, yes, we do strengthen them. But the concept is you'll only do your strengthening maximum 3 times a day, you know, and you might only be able to hold for 5 seconds and do 5 of them. And then in between times, you focus on letting go. So you have to up train with down training. So if you know you're a high stress personality, particularly over this time, and you know you grip, we work on the down training constantly, but you've got to strengthen them as well. So I hope that one helped. Okay, again, another good question in terms of breast. So is ultrasound essential? No, it's not essential in terms of, again, the lactating breast. But what I do find is essential is that advice. So if you're concerned about coming out, I definitely recommend telehealth, because we can go through a lot of questions to work out what's the cause. The most important thing is to try and prevent them reoccurring. So the biggest factor in terms of getting mastitis again is having it the first time. And we want to actually get rid of the scar tissue or any adhesions in the breast. Because obviously the milk, if there's stasis, the protein moves out into the surrounding tissue and it sets up an inflammatory response. And if that inflammatory response isn't removed, it just sits there and can potentially congest again. But most of the time it's fixing the attachment issues and or the the bra, so constraints, pillows, anything that might be contributing to the development of it. Sometimes your hands, I often find the mum's hands where they're placing them whilst they're feeding, even just to prop the boob up, sometimes can cause a problem. So, yeah, some really, really good questions there. Oh, fantastic. Again, some thank yous. So I'll just go ahead. So Jane and I are going to talk next week about constipation. And this is our gorgeous team at Pelvic Health Melbourne. So we are open and available if you want to see us or find your local pelvic health. Thank you for the opportunity to chat to you, and I hope it was helpful. We'll be back again next week. Bye.